This is Cannaramic, and we're bringing you cannabis like you've never seen it before.
Today, we're so excited to have Dr. Brian Donner of the Compassionate Care Centers in Pennsylvania. This doctor has come a long way and off the beaten path, I would say, for traditional doctors. You've got your centers, you got over 10 centers in Pennsylvania. You've got over 20 doctors in your centers. You've seen 25,000 patients or so in the last 2 or so years since you've been in business. I'm excited to have you here. Welcome to our program.
Well, thanks so much for having me. I'm really excited to be here. Like you said, my name is Dr. Brian Donner, and I'm the co-founder and chief medical officer at Compassionate Certification Centers, which is a medical cannabis healthcare organization that really serves patients in Pennsylvania particularly. So a little bit of background about myself. I'm board certified in emergency medicine, and then I spent some time doing fellowship training in wound care and hyperbaric medicine. And during that time, I really got heavily involved in clinical research as well. After I got out of residency and started practicing, I think two things really drove me into medical cannabis. Number one was what was happening from the opiate standpoint that I was seeing firsthand every day at work. The second thing was that I had some patients in the emergency department, some young children who had a genetic seizure disorder who I used to see on a weekly or every other weekly basis. And one day they just stopped coming, and myself and my colleagues had assumed the worst. And a few weeks later, we saw one of the mothers in the emergency department, and she looked wonderful. Her child was doing great. And I had said, well, what are you doing? What's going on? And she had been going to Colorado and getting cannabis oil and treating her child. And it really opened my eyes clinically to what I knew already from a science standpoint, but from what I saw actually with patients. So out of that idea, our company was formed, and really what my goal is for our organization to be a full-service medical cannabis healthcare organization that can serve patients in any of their medical cannabis healthcare needs.
Wow, it's not often that doctors are surprised with exciting news from patients that have kind of gone off the grid and are doing things that you guys are not familiar with. But one of the other things you talked about is how when you were in your residency in the ER, you were seeing at least one opiate overdose every day, and how that impacted you for medical marijuana. Talk a little bit about that.
Absolutely. This is a big part of my story as a physician, and honestly, how cannabis has made me a different doctor and what I think is a better physician. But in the emergency department, obviously that's the front line for the opiate epidemic and overdoses. And literally I couldn't go through a single shift where typically I would see somebody young and lives being ruined all the time. And the most discouraging thing to me was that there really didn't seem to be a solution to this problem. And as I went through residency and practicing as an attending physician, we saw this more and more and more. And when medical cannabis came around, really it was what I deemed was one of the major potential solutions to this problem. And not only theoretically, but we started to see this real time with our patients as well. And it was honestly something I didn't anticipate when I first got into medical cannabis, but I think it's a tremendous potential for this medicine to help so many people that need it and really to stop unneeded death in our country.
Right. So I understand that people are using medical cannabis in lieu of opiates to control pain. I've been speaking with a number of athletes who have been talking about how the opiate situation is a problem within the pro-athletic community, and how people have been using medical marijuana against the advice or the law, and they've been getting relief, and also to get off of opiate medical marijuana.
Absolutely. And I think that last part that you said really is key, because one of the things with medical cannabis that it can do, it's like the old adage, can kill two birds with one stone. So when you're talking about patients who are on opiates, particularly for chronic pain, medical marijuana can do two things. Number one, it can take the place of the opiates in managing patient's pain and as an analgesic, right? The second thing that it can do is it can really help to reduce the symptoms of opiate withdrawal. So whenever you put this into a combined treatment plan, it's really ideal. You can get something that's natural, much less toxic, that can treat symptoms and control patients' pain, while at the same time assisting them in getting off of the opiates and preventing them from getting back on it. And we've seen tremendous results with this so far. They're very, very encouraging.
Wow. What's the medical community saying about this? I mean, again, this is off the beaten track. People still scoff, and I know your colleagues probably, there's plenty of people who scoff at medical marijuana. You know, the whole idea that there's not a lot of science, there's not a lot of real data. You know, what are they saying about your track here and the viability of it?
Yeah, I love getting this question because it's changed so dramatically since I started, really. And I can tell you, when I started in medical cannabis, 4 to 5 years ago, I was really ostracized by my friends and my colleagues. And fast forward till today, where there's a lot of those folks who actually are involved and work with us now. So it's been a tremendous change. And I really think one of the things that, particularly with physicians or providers, that we focus on is the endocannabinoid system, right? That all humans, and in fact all animals, are born into this world with an endocannabinoid system. Our body makes these molecules naturally, and the plants really have analogs to it. So I have found that when you speak to physicians or providers about the science behind it, and once they understand that, they really can grasp onto it because it works very similar to some of the other biochemical systems in our body. And unfortunately, in medical school and in residency, nobody tells us about this. I never even knew there was such thing as an endocannabinoid system until I took the time to do it myself. So although the stigma is absolutely still there, day by day, we see it, the wall getting broken down. It's really a neat thing to be a part of and watch real time.
Wow, there's a lot of work we've got to do to get our physicians more educated about new. It's not even so new, but it's definitely not being taught, like you said, in medical schools. So you've got 20,000 or so patients that you've seen, and that's a huge amount. What are some of the patients you're meeting? What are their demographics? What do they like? Are these kind of new people, young people? What type of folks are you meeting?
Yeah, this is a common question we get, and my answer is really it's broad spectrum across the board. We have had patients as young as 2 or 3 years old. I think my oldest patient is 102 years old. So we've seen really across the entire spectrum. I think whenever the program first started, we actually saw a high number of pediatric patients. That has since somewhat tailored off. I think that, particularly in Pennsylvania, the elderly population, we have started to see more and more of that group as time has gone on. I think from a symptomatology or disease entity standpoint, I think chronic pain tends to be by far the most common. However, we have many other patients, whether it's PTSD, cancer, autism, epilepsy, anxiety, insomnia, really across the board. So, and we've found that it's so important to have provider guidance, that providers who have not only understand the science, but also have clinical experience, because medical marijuana isn't a one-size-fits-all type therapy, and it's really tailored to each individual patient. And it's important that you have the appropriate guidance and follow through when that happens. So that's one of the things we've seen over the last year or so.
Well, that must be difficult for you to find physicians that are prepared in that regard, because it's not like you said, they're not teaching it. So you're having to actually cultivate your own physician community to be able to treat patients in your centers, no?
Yes, absolutely. And in the state of Pennsylvania, they have a educational program for the physicians, but at Compassionate Certification Centers, we've integrated our own educational model for our physicians, for all of our providers, and for all of our employees, just so that everybody understands things and that we give consistent, reliable information. Whether you go to one of our clinics in Pittsburgh or in Philadelphia, you're going to be getting the information that you need accurately and consistently. But yes, it is difficult, but to be honest with you, it's something that we've really enjoyed, and we've been able to grow as an organization by learning together and help to spread the word.
Right. I'm so surprised that, you mentioned the full spectrum, in as young as 2 years old. I would be, thinking people would say, oh my God, you're taking your kid and you're giving your kid, marijuana, for those, don't understand. And then you're talking about elderly people who, have grown up throughout the years of stigma and propaganda, who are now using it. That's so interesting that people have, you're seeing people from such a range. I would think that maybe the younger people would be the higher range, but you're seeing the whole range. It's really, really interesting. So
It is.
yeah, you talked about some of the symptoms, and you mentioned that people come and they have a variety. Talking about from cancer pain, chronic pain, various things. So let's just talk about the symptoms again, and let's talk about how do the patients come to you? Do they come to you with these diagnoses already? And do patients typically, have a referral? So talk about the symptoms again, some of the top issues that they're seeing, and then how do they get to you?
Yes, most definitely. This is a great question. So I would say that patients get to us in a variety of ways. I think that there's traditional marketing, PR advertising that you would see throughout modern medicine. I think the Department of Health obviously provides a list or publishes a list of providers so patients can go there. Word of mouth, other providers has really been another way. So you typically, though, once a patient gets to us, it's a relatively simple process. They can call. We have a centralized toll-free number that our staff is then educated at that point to help really start the patient through the process, whether it's helping them obtain medical records or the appropriate clinician for a diagnosis. Maybe it's setting them up at a geographic location that's close to them as well. But really, we've set up our organization to provide all those support services for patients. Most patients will come to us with the diagnosis, a history of something causing chronic pain, a history of PTSD. However, many patients sometimes don't think that they have a qualifying diagnosis yet. When we're able to speak to them, they actually do, right? A good example of this, I've had so many patients ask us, well, I don't have chronic pain, but I have migraines. Well, in our world, the way we treat it, that is chronic pain, and that would fall under that category, right? So the patient might not initially understand that they have a qualifying condition when, in fact, that they do. So it really comes down to the educational process. And we've set up our organization, like I said, to do that. And there's a lot of layers and redundancy built into that as well.
Okay, but each state definitely has various qualifying conditions, right? So in your state, you have 21, I understand, qualifying conditions for medical marijuana? And a
yes, that's
person would then look through the list, but they may not realize you're saying that something on the list is something that they actually qualify for. So those 21 conditions, let's just, things like ADHD, is that covered under medical marijuana?
So in Pennsylvania right now, ADHD is not one of the conditions. We're talking about things like autism, epilepsy, chronic pain, inflammatory bowel disorder, cancer, Parkinson's, neurodegenerative disorders. But it's a great point that you bring up, because just because you don't have one of those 21 qualifying conditions, it doesn't mean that medical cannabis couldn't be beneficial for you. For example, in Pennsylvania, anxiety and insomnia are two conditions that are not listed as qualifiers. However, we know that medical cannabis could potentially be beneficial for these type of things. So there is another alternative for that, and that's really whenever we start to talk about CBD or hemp-derived CBD type of therapy. But yes, it makes it very difficult for patients because, for example, whether you live in Illinois or Pennsylvania or Ohio, the qualifying conditions for medical marijuana might be different. And I'm sure we'll talk about this in more detail as we go on, but it makes the landscape sometimes difficult to navigate for patients.
Right. So you mentioned that if a person doesn't qualify, and there are a lot of things that they can qualify for, but if they don't, then they could feasibly have some treatment with CBD, which your organization also provides guidance on. And that's a big deal because, you know, these days CBD is everywhere. It's in all the stores, and the packaging is very confusing. It's how many milliliters in this bottle? Is this full spectrum? Does it actually have CBD in the bottle? What do the lab tests say? You know, it's just, and then it's all the different delivery systems. People buy, you eat edibles, you have tinctures. So that's a wonderful resource to have at your organization where a person can get guidance as to CBD as well. How does that work for, you know, a person who's not doing medical marijuana, but is going to be using CBD? How do you work with that type of client?
Yeah, and you brought up so many great points that we'll hit on again, but you really hit the nail on the head. So CBD, as we know, it's one of the cannabinoids within the cannabis plant, and we know that it has certain properties. It's anti-inflammatory, it's neuroregenerative. So all of these type of things can really play a role in patients physiologically. Now, the fortunate thing, because of recent legislation on a federal level, hemp-derived CBD, so whenever you can derive that molecule from the hemp plant, which by definition means that it's high CBD and low in THC. Whenever we do that, patients do not need to have what we would say a qualifying condition or a medical marijuana card like you referenced. However, patients still really need guidance on this type of therapy. As you mentioned, there's different routes of administrations, whether it's inhaled, whether it's taken orally, whether it's used topically. What's the dosing parameters? What's the frequency? And then you also hit the point where nowadays you can go down to the local gas station and buy CBD. I don't know if this is necessarily a good thing because, as you said, what's in that product? Does it have the CBD that it says? Does it have pesticides, heavy metals? Has it been lab tested? So we really incorporated CBD therapy into our treatment plans because, number one, we felt that all patients should be able to benefit from medical cannabis therapy, not just if you had one of these qualifying conditions. And number two, we wanted to be able to provide our patients with quality products that are consistent, that are at a fair and reasonable price point as well. And that we found that our patients, that when they receive guidance from a provider with regard to how to best use this product, those are the ones who are the most successful. And conversely, the people who may just go down the road and buy it from the local gas station or the pharmacy and start taking it, there's a really high treatment failure rate, and it's really preventable. So I'm so glad that we're talking about this because it's an easily preventable issue that a lot of patients should be aware of.
Right. So we're at the point now where a person decided they want to call you and they want to find out about medical marijuana. It's very, very important, right? The first step is they make the call. When they get on the telephone, what do they experience? What happens there?
Absolutely. So what we tried to do was set up our organization as similar to traditional doctor's offices as we could, just so patients could have that comfort level. So you can imagine the patient picks up the phone and they call our 888 number. At that point, they're going to get one of our employees or representatives who's basically been educated on taking the patients through the process. So in Pennsylvania, that's a multi-step process. We tell the patient how to get registered with the Department of Health. We also get the patient registered with our organization. There's consent and release form signed. We make arrangements to obtain the patient's medical records, and then we'll actually set up an appointment with the patient to come to one of our offices. Once the patient comes to our office, it's just like any other doctor's office appointment. They're going to check in with our front desk staff. We'll make sure that's everything in order. The patient then goes through what we call an intake appointment with one of our nurses, where they do a history, a physical exam, go through medications and allergies. And then following that, the patient will go through an interaction with our doctor, where, again, the doctor will go over their medical history, a brief physical exam, and then the not only the Pennsylvania medical marijuana program, but really medical marijuana in general, the medications, the dosing, the frequency, everything is explained. Then at that point, we arrange for follow-up for the patient. whether that's by phone, over the internet, or in person, and then we can provide the guidance that way. So I would say that's a typical patient interaction from start to finish at Compassionate Certification Centers.
I would think that, you know, people may feel a little bit weary about coming out. Worry, I would say, about coming out, right? So you're having to actually go to a place that has medical marijuana, you know, to learn about medical marijuana, get a license. Do people feel a little hesitant about coming to a brick and mortar location and, you know, kind of coming out the closet?
I think people do. There's always a sense of trepidation we see in a lot of our patients, right? And I think it's because they're essentially walking into something that they're not familiar with, or is the unknown more. Now, and again, what we've tried to do is sort of build a comfort level in there that's layered on different levels. But yes, it's a really common thing. People are anxious, they're nervous. You see a lot of hands like this, and but usually by the end of the appointment, when people walk out, you can really see how much more relaxed they are, because not only have we educated them on the products, but we've also explained to them how the state program works, the rules, the regulations, and the laws. So that's a really large part of this. That it's one thing to understand the science and how the medicine works, but people want to know the practical answers too. What do I do if I have to drive? What do I do with my employer? All of these things are really important, and it's just another reason why you need really legitimate providers to guide you through this process.
Yeah, I mean, no one would want to walk into some place and then a police bust in, right? So they're nervous, you know, to make sure that this is legit. I don't want any problems with the police. So we talked about that process with client when they come in, and you kind of do the survey with them and about the pharmaceuticals they may be using already. And I understand, I've heard that there's certain pharmaceuticals that have contraindication of medical marijuana. One theory I've heard is if you can't have a grapefruit with your particular drug, then you should not be taking medical marijuana with that drug as either. So can you explain that whole theory, or how that works, that you know whether you should take it or not if you can take grapefruit?
Absolutely, and I'm really glad you brought this up, because it's super important. This is really similar to any other medication or medication food interactions that we have in modern medicine, and as physicians we're familiar with doing this. So sort of along the grapefruit line that you were talking about, we know that cannabis is processed largely through the liver, through a particular enzymatic pathway that's very common in medicine. And what we have found is that if certain other substances are also processed through that same enzymatic or metabolic pathway, it can affect not only the levels of that medication either becoming higher or lower, but also the levels of cannabis becoming higher and lower. And it's all about that process. So that's another reason it's really important. What we do during our appointments is we will take a look at patients' medications, and we'll really look for any big red flags or tough medications. So for example, there's some of the blood thinners or anticoagulants. You can see interactions with those. Some of the anti-epileptic drugs as well, you can see changes in those levels. So it's really important, even more important for patients who are on any type of medication, even if it's over the counter, to make sure that they discuss this with their provider, and that's known before they start on a medical cannabis treatment plan. And this includes CBD as well. This is not just full spectrum medical marijuana from the dispensary. So I encourage all my patients, if you're on any type of medications or you take anything else in addition, discuss that with your provider during your certification or your cannabis evaluation.
Yeah, that's interesting, because when you go to the pharmacy, typically if you go to one of these larger pharmacies, they'll have all of your drugs, and they'll be able to tell you what contraindicates, and your pharmacist would be able to give you that guidance. But in regards to medical marijuana, you're in a whole different unit. There's all your drugs, then you have medical marijuana. So having an organization like yours to give that information is so vital. So that's why it's important for people to make sure that they're at the right place when they're having their medical marijuana treatment, or they're getting their medical marijuana license. So we talked a little bit about patient education, and that's a big piece of what you do. This is a different paradigm than what people are used to with the typical doctor. Everything that you're doing is different. I know you've tried to make it look very similar for our comfortability, but people are not used to the idea that they have power and control over what their medical care, that they're not interested, they're not used to being educated by their physicians. Usually the physician, after the nurse sees you for 5 minutes, the physician breezes in, he looks at your chart and he tells you what drug you're gonna take. Well, in this case, you guys have a whole process where you're educating along the way, and you're actually having to spend a lot of time with that patient to help them understand what they're doing and how to do it and the law. How important is patient education to the success of medical marijuana treatment, as compared to typical? And what are some of the key things patients need to understand?
Yes, this is a great point, and this is one of the things that actually I love most, I think, about medical cannabis and really the movement. So when you think about medical marijuana and how it's been sort of instituted into our healthcare system, it's different than what we've seen traditionally. It's usually because of physicians, researchers, pharmacists, big pharma, whatever it may be. Medical marijuana is different. It really was a patient-centered movement, and it did. You said the word paradigm. It's really a paradigm shift, and not only in medical marijuana, but in healthcare in general, in our country, and I think across the globe, where patients are taking it more into their own hands. So rather than me, doctor, tell you, patient, what to do, it's me, doctor, help give you some of the tools so that you're able to really treat yourself better. And I think medical marijuana is the perfect example of the way this is shifting in our country. We see it with medical marijuana in all of our patients. This is the reason where we could have two patients with the exact same diagnosis, same sex, same age. We put them each on the same medical marijuana preparation. One has a fantastic response and one doesn't, right? Why is that? It's because we're all individuals. Our endocannabinoid systems have different balance and requirements for homeostasis. And if you don't treat everybody as individuals, then you're not going to get the results that you want. This is so important in medical marijuana because typically the way that we treat patients is that we educate them and we give them the tools and we give them a starting point, but the patients then really take it from there, right? We give them guidance and we help them, but it's really a patient-focused or patient-centered treatment plan. And in my opinion, it's really how medicine should be. And I think it's really great that this is one of the changes that cannabis is going to help institute in the healthcare on a broad scale that probably we don't even appreciate yet. So I appreciate you bringing that.
Yeah, so patients will now be empowered and educated instead of just dictated to, kind of to some extent, victims of, what the system can provide. So once a patient has been seen and they are kind of on their way, give them some guidance as to what they should look for, because they can't get the actual medical marijuana from your offices. They have to go to a dispensary. How do you translate for them what they need to do when they get to the dispensary?
Yeah, so another great question, and this sort of leads down a little bit of a rabbit hole when we talk about the federal versus the state law, particularly for physicians. So we all know that cannabis is still illegal federally, right? And really these rules that we talk about, particularly for full spectrum medical marijuana, getting your card and going to the dispensary, are on a state level. As a physician, we in order for me to prescribe medication, I have a DEA license. And the DEA considers marijuana illegal. So the trouble from a physician's standpoint is that theoretically, if we write a prescription for medical marijuana, the DEA can then take our license because it's a Schedule I substance. Without a DEA license, we can't practice as physicians. So fortunately, on a federal level, the case law in the past has found a way around this, and that's the actual certification. So rather than me write you a prescription, I, as a physician, make a recommendation or an attestation that you're eligible for medical marijuana. This is a really slippery slope now from a federal level because theoretically, me as a doctor, when I tell you what to take as a patient, that crosses the line into prescriptions. We as an organization have felt that's not good enough. We need to guide our patients. And so typically what you will see is we will go over with our patients in the appointments, the whole endocannabinoid system, educate them, and then we will outline a treatment plan for them that we think is a really good starting point. So that way when the patients go into the dispensary, we take the guesswork out of it, and they really know what they're looking for, where to start, and what to take. But it's a problem with the system and the way it's built, and we need to really change it, because patients oftentimes don't get the guidance they need just because physicians or providers are in a difficult spot.
So let me understand this. You have a license with the DEA, right? Because you are in medical marijuana, you have to have this license. But you are not able to specifically state that this is the strain of medical marijuana that you should be taking, because that would be illegal. So how does a person know? I mean, okay, so you're educating them, and in that education, they learn about the different strains, I guess, the different delivery systems. And then from there, they're able to be empowered to be able to make choices at the dispensary. Is that how it works?
Well, yes, and honestly, it's, I sort of smile and laugh here, because we get this question all the time. What we do at our organization is sort of take it a step further. We're literally telling our patients, hey, this is what we recommend you take. We think this would be the best for you. Fortunately, in Pennsylvania as well, there's some redundancy set up where there's pharmacists in our dispensary, so the patient has somebody on site as well to ask about that. But technically, by the lay of the law, the patient is able to go into the dispensary, and even if I told them to take something and the pharmacist told them to take something, they could take something different, right? And this is a flaw in the system and the way it is. Now, I can tell you this, the overwhelming majority of our patients who come to see us, they want our help and they want our guidance. So they listen to what we tell them, right? And we guide them as much as possible. But, and again, when you go to a different state, the system may be completely different again. So this is what makes it so hard, and this is why education is so important. And this is why it's important that folks like myself and you, that we really push the envelope with these type of things and try to do what we think is right more than anything else.
Okay, so I'm just thinking that, despite the fact that you have an actual center and it's brick and mortar and you're a doctor and there are doctors doing this, and we know that there's science, there are many people who are skeptical about the possibilities of medical marijuana. They believe marijuana is not real medicine, and it's for the purpose of people who really just want to get stoned, and they're using medical marijuana as an excuse. They would rather suffer with chronic conditions than to experiment with medical marijuana. This woman in my church, I've spoken about her several times, who has lupus, and I explained to her, listen, you might be able to get some relief from the pain that you're enduring with lupus with medical marijuana. And she said, I don't mess with that stuff. So tell us a few success stories. Out of the 25,000 patients that you've seen, tell us real life, what happened, this is what the person came in with, and this was the result that they experienced.
Absolutely. I could give you a million, and I'll give you some right now for sure. Let me preface this, I suppose, with saying that I've been a practicing physician for about 10 years now. And I can say with full certainty, I've seen medical marijuana help more patients than arguably anything besides antibiotics in my career. Where modern medicine couldn't help before, I've seen cannabis help people where otherwise hope was lost. And it's had a profound impact on me as a practicing physician. So I'll give you a bunch of sort of feel-good stories here and everything. The first one is just I used CBD. My best friend that I've had for about 15 years or so had been on Ambien for the last 10 years or so. He had started to have some really, really significant problems with it. Just using hemp-derived CBD alone over the course of a month, I was able to wean him off of his Ambien, get him off of it completely, and he now tells me he slept the best that he has in his entire life. My own mother is a patient as well. My mother suffers from rheumatoid arthritis. She's had 2 failed back surgeries and a knee replacement. She really was having a difficult time from a pain standpoint. She had been taking narcotics, oxycodone, every 6 hours. My mom was as skeptical as could be from marijuana. I don't think she's ever even looked at it in her entire life. We were able to very gently, by starting her on CBD and then titrating her up to a preparation that was really high CBD, low THC, to now to the point where she's been able to wean herself completely off of her opiates and has put off her next surgery. We had an autistic, I'm going to call him a boy, but he was 17, 18 years old, who wasn't able to communicate with his family at all. We saw him about a month after the medical marijuana program in PA began. 6 months later, he came back with his family, and with the help of a speech therapist and through an iPad, he was now able to communicate and was able to tell us how medical marijuana changed his life. I had a father come in the other day with his son, who midway through the appointment, his son had been addicted to heroin, had been on Suboxone, morphine, had been in and out of jail, in and out of psychiatric institutes. His father came in with him that day, literally just to give us a hug and to say thank you. His son was now off of all narcotics, all opiates, confirmed with drug tests with the PDMP. And not only did it help the patient, but his family as well. So I could tell you so many stories here. They could just spill off my tongue. Children that have gone from 100 seizures a day to 5. The results are profound. And on that same token, I can also tell you this. I haven't seen anything horrendous happen from cannabis. Somebody, there's respiratory depression, you stop breathing, it shuts down your kidneys, it shuts down your livers. I haven't seen any of those horror stories. And I remember Dr. Cyril Wecht, who's probably one of the most world-renowned forensic pathologists ever. He spoke at our event last year, and one of the most profound things he said, that in the tens of thousands of autopsies and causes of death that he's had in his career, never once has endocannabinoid toxicity been listed. So story after story after story I could tell you, so I'll be quiet now.
Wow, that must be so rewarding, because that's what doctors go to school for. They go to school because, well, we know that doctors don't make a ton of money anymore. I mean, it's not like the most lucrative career. So the people who are going to school because they want to make a difference in people's lives. But because of the current healthcare paradigm in our country, it's just not happening anymore. People are not being made whole. They're not getting better. They're not healing. So to be able to be in a place where you're getting success, that must be so gratifying for you.
It's extremely fulfilling. I can't even tell you. And the other thing, I said earlier, I really think that I'm a better doctor now than I was 5 years ago, 10 years ago. I know it, as a matter of fact. And it's something that makes me happy and makes me proud. And to be able to be a part of something like this, that, this change happens one time in the history of our country, and to be able to do this and to do it the right way is really an awesome thing, and it's something I'm so happy about.
Well, we are excited for you, Dr. Donner. You keep going. You keep opening up those centers all over the world, all over the country. We'll be looking for our own CCC here in the New York City area soon. Hopefully you'll be rolling out as regulations roll out across the country. And thank you so much for all you do to help people understand, to work at the ground level, the grassroots level with people who are suffering, to give them real relief and real options for making life changes in their families. I mean, the impact of the work you're doing is so profound. Thank you for all you're doing. And I know that you've given us cannabis in a way we have never seen it before. I think people are going to get a tremendous amount of value from this. Thank you so much.
Thanks so much for having me. And you guys keep up the great work too. It's so important. So thanks again. It's been a true pleasure.